Three people in Sindh, southern Pakistan died due to Naegleria fowleri, also called as brain-eating amoeba. I am Dr. Nadeem Sajjad Raja. What is Naegleria fowleri? It is an amoeba, causes brain infection, nearly always fatal. Naegleria fowleri lives in soil and warm, fresh lakes, rivers, ponds, and hot springs around the world. Also found in swimming pools, splash pad, and tap water, but very rarely. It enters through the nose to the brain and causes infection, which is called as primary amoebic meningoencephalitis, or PAM or PAM. So what are signs and symptoms of PAM? Early symptoms include headache, fever, nausea, and vomiting. PAM progresses rapidly. Most people with PAM die within 1 to 18 days after symptoms begin. Incubation period is usually 1 to 7 days. It usually leads to coma and death after 5 days of infection. As PAM progresses, symptoms can include stiff neck, confusion, lack of attention to people and surroundings, loss of balance, and hallucinations. Brain infection when someone goes for swimming, especially in long hot weather and lower water levels in lakes. People rarely get infected with this amoeba when they wash their nostrils with tap water, because it is also found in tap waters as well, but very rarely. How this infection is diagnosed, because it is a quick and patient deteriorates rapidly, so it's difficult to diagnose. Anyway, your doctor will decide by using different laboratory tests. So they will take cerebrospinal fluid from the spinal cord and brain biopsy, and they will send it to the reference lab for the confirmation of this disease. If you experience such kind of symptoms after swimming in the lake, please seek help. And if it is diagnosed early and treatment is started early, then better chances of survival. So this disease is usually treated with antifungals, antibacterials, and sometimes the doctor use combination of antibacterials, antifungals. For example, amphotericin B, rifampicin, fluconazole, and miltefosine. That is also used to treat leishmania. So let your doctor decide which treatment is best for you. How you can reduce Naegleria fowleri infection? There are several tips that you can reduce this infection. Hold your nose or wear a nose clip if you are jumping or diving into fresh water. Always keep your head above water in hot springs. Don't dig in shallow water, because the amoeba is more likely to live there. Always use distilled or bottled water when you are rinsing your nose. Thank you very much for watching this video.